Yes.
Hello, everybody. Thanks for logging in. We'll get started in just a few minutes. We're going to wait a few more minutes until everyone has logged on. But thanks again for joining us. Hello, everybody. We're going to get started in just a few minutes, but we want to thank you for logging on today for Take Action Asthma. I'm just going to wait until a few more people join us, but thank you again.
I'm just gonna put my door, I'm gonna go on this asthma form. I'm gonna talk that.
Hello, everybody. Thanks for joining. We're going to get started in just one more minute. Just as a reminder, as you are joining, please remember to mute your microphone. And this is being recorded, so thank you. We'll get started in one more minute. Hello. Thanks and welcome to Take Action webinar. Before we get started, just a few housekeeping notes. Please mute your microphones. And as you may know already, but this is being recorded. The slides and videos will be shared with you in a follow-up email after this webinar. A reminder to type your questions in the Q&A. We won't be able to get to everyone because of the high number of attendees. But we will share resources at the end of the presentation and try to address as many questions as possible. Again, please reserve the chat for comments and use the Q&A function for questions. A disclaimer, no doctors or clinicians are here today. The purpose of this webinar is education, awareness, best practices, and resources on how to support you and those in your lives with asthma. My name is Heidi Breyer. I am the Wellness Coordinator at WorkWell NYC, and I will be your host today. Today, we will learn about asthma, how New Yorkers are affected, who diagnoses asthma, what triggers asthma at work and school, how to manage it at work and home. A few words about WorkWell NYC for those of you who are not familiar. We are staffed by city workers, and we are your worksite wellness program. Our programs are inclusive of Move More, Eat Well, Take Action, Be Well, and Project Build. We are currently the admins of the flu clinics, all rolling out all over the agencies, all over the city. And we also have a very exciting summer wellness block party coming up. You can find out more at nyc.gov, Workwell NYC. It is my pleasure to introduce our commissioner here at the New York City Mayor's Office of Labor Relations, Renee Campion. As commissioner, she manages the negotiation, implementation, and enforcement of all labor contracts with the city government's 150 collective bargaining units, representing 360,000 employees, as well as overseeing the city's health insurance, deferred compensation program, NYC EAP, and Workwell NYC. Renee is a very busy woman, and we are very excited that she took the time to join us today. Renee?
Oh, I was on mute. Hi, everybody. Thank you so much, Heidi. Thank you for that lovely introduction. I'm so excited to be here today. When the Workwell team asked me to told me about this asthma forum, they asked, they know, just my close team knows that I am a sufferer of asthma myself, and they asked if I would say a few words, and I was thrilled to do so. So I'm so happy to be here. And I see we've got about 105 participants so far and growing. So it's very exciting to talk to all of you. So let me start. As I said, I was diagnosed with asthma myself about 20 years ago by my allergist. I've been in city service about 21 years. So it's basically the whole entire time I've been in city service. When my allergist told me that I had asthma, it came as a complete surprise to me because I thought all I had were allergies that flared up from time to time, and maybe a regular seasonal cold that I thought was my biggest problems. And honestly, it kind of freaked me out when the doctor said the word asthma to me. I thought that was it would seem like a very scary word to me, and I didn't really know what it meant or what the impact, on my life would be. Thankfully, though, my doctor was able to give me enough information at the time to allow me to start to get my head around it, which took more than a few counseling sessions, I would say, with my doctor, going through all the tests and things like that. Personally, and I know many of you, I'm sure, are the same, I've carried around a rescue inhaler for the past 20 years. No matter where I am, 24/7, I always have it. Up until about 15 years ago, I think I maybe used it about once or twice total. So I was pretty lucky for those first 15 years. In the last 5 years, I would say I use it more than I'd like to, more than I'd care to admit, but I have used it more frequently, which concerns me. I'm able to appreciate, I have to tell you, with all my doctor visits and follow-ups, I'm able to really appreciate the city's health insurance that we have as public servants, all of us. And I see my doctor on a regular basis for tests, preventive medication, and flare-ups. I feel lucky that I'm able to see her and now him. I've had to transition over, but I feel very lucky that I'm able to do that. When the Canadian wildfires happened back in May and June of this year, I was particularly impacted. I knew I had to wear a mask all the time, inside and out. I immediately smelled the smoke, and it had a severe impact on me. And I knew I had to keep as much of the smoke out of my lungs as possible. So I just wore that mask and traded it for new ones on a frequent basis. It was a very scary time for me, and I know for all of you and many New Yorkers, seeing that sort of orange glow that was in the air, and also smelling the smoke, and for many of us feeling like we were having a lot of trouble breathing. I know many of you have had very serious asthma that required you to go to the emergency room multiple times. I know you or your family members, spouses, children, others, elders have had to go to the emergency room multiple times and often have to stay in the hospital to be treated. I personally have never had an asthma attack go to that extreme, thank goodness. But the fear of not being able to breathe exists for all of us. I'm very grateful for the webinar program today that Workwell has created for us, and I hope it will provide you with the resources necessary to be more informed and supported take charge of your health, and live your very best lives. Heidi, with that, I'll end and move on. Thank you very much, everybody. I'll be staying on for the rest of the forum. Thanks.
Thank you very much, Renee. Really appreciate you coming and sharing your story with us today. Next, I am thrilled, excuse me, I have a little asthma as well, to have these speakers with us today. Jessica Jackson, Zulima Uskanga from AFA, and Linda Notesart from NOS Health, formerly of H&H Woodhull. And I'm just thrilled to have these three ladies on with me today. But first, we're going to have a poll question. You should see a poll show up in your screen, hopefully. If you don't, the poll is on your screen as a slide. So if you have answers, you can type them into the chat if you wouldn't mind. You can type yes, no, yes, but it's in remission, or not sure. Oh, great, they're coming in. Thank you. Thank you. I'm sure a lot of you also have family members with asthma, but this is just about you today. Okay, great. And the results are in. Hopefully you can see that. We have over 50% say yes. 32% say no, so I'm guessing those are for people you know or people you love. So thank you for answering that question. All right, I'm going to share the results. And so now hopefully you can see the result on your screen. Okay. Yes, some of you are here for your children, which is great. All right. So we are going to kick off with what is asthma? Most of you probably know what asthma is, but it's not bad to go over this. Asthma is a chronic lung disease caused by inflammation and constriction in the lungs. It has no cure and doesn't go away, but those with asthma can be symptom-free by managing their asthma with medication, a rescue inhaler, and a daily inhaled steroid and/or biologics. The most important thing is symptoms are different for everyone. So if you have children, you might find that your daughter's symptoms are different than your son's symptoms. So who gets asthma? Well, we all know that it can be diagnosed at any age. Children are the most affected by asthma. That's because their respiratory rate is faster than adults. If there is a family history of asthma, there's higher probability that you or your loved ones will have asthma. The environment, natural and work environment can all play a part. As an example, hairdressers often develop asthma as a result of using hair products. Well, I think Renee touched on the air we breathe. The June 7th event was quite jarring for a lot of us, but we also have the ability to check on the air quality daily if you want. There's EnviroFlash. You can sign up for them. They will send you air quality alerts. And there's airnow.gov. Airnow.gov is run by the government. They have facilities all over the state, and they will measure the PM particulate matter 2.5 and 10 and the ozone levels by zip code. When they're high, often in the summer, this can affect sensitive New Yorkers and those with asthma. Again, I'll share all this information with you in an email after the webinar. So asthma in New York City. We all know a lot of people have asthma here, but specific to New York City employees and their families, we constitute about 14% of the New York City population. So based on that number and using 10% as the prevalence of asthma in New York State, approximately 100,000 city employees are estimated to be affected by asthma. That's a lot. So this is my great segue into introducing you to Linda Notesart, mostly called the Asthma Lady. She has dedicated her life to being the lady to go to with asthma. And she's an asthma educator. She was formerly at H&H Woodhull Hospital, where she oversaw the New York City Department of Health Asthma Center for Excellence. She is passionate about reducing ER visits for pediatric patients and in closing the gap for under-resourced people. So Linda, I'm going to throw this off to you. Thank you so much for being with us today.
Yes, thank you. So can you guys hear me, see me? All good.
Can hear you. Yep.
Okay, yes. So yes, thank you so much everyone for having me. I'm super excited to be here with you guys. Thank you, Heidi. Thank you, Workwell. And as a New Yorker and as someone with asthma, and like Heidi said, as someone that used to work for the city, I miss you guys. I'm always excited to do things like this. So thank you so much. Okay, so when it comes to asthma, okay, so with all the medical advancements that we have around asthma, asthma is still a burden for this country, and it is an expensive burden. And it's unfortunate to say that some communities carry a bulk of the burden more than others. And so when we talk about this, we're talking about we know asthma is mainly biological, but what we're seeing is that when it comes to asthma outcomes and asthma being managed, we're seeing that this is largely attached to the social determinants of health. And so what the social determinants of health is, all that is just what things that affect our quality of life and our health in general. So things like having access to quality foods, fruits and vegetables, access to green space, our housing, where we get our education from, and things like this. All this determines, our livelihood. And when it comes to asthma outcomes, so it's not simply just talking about the medications. We're also considering all these things as asthma educators and clinicians. We talk about these things and address them as well. So. Oh, I'm sorry, Heidi. Can you turn next slide? I'm trying to do it on my own. Yes, Heidi, thank you. So when it comes to asthma education, where I always start from is, how do we breathe? How do we breathe? And so I never assume that someone knows what lungs look like, because we all comes from different walks of life, different cultures. So I start with how do we breathe? So breathing starts when you air in through the nose and the mouth. And when you breathe, it goes down the throat and it goes into these two balloons, which are our lungs. So what I do is I show people the models, or I show them the videos, the pictures of what lungs look like. And if I can't, I try to give them the visual. Oftentimes, I give the visuals of a big old tree. And so a tree with a lot of branches. And what I show them and let them know is these branches, like the smallest of the branches is where asthma would take place. So asthma takes place in the small airways, because there's so many lung diseases out there and a lot of them look the same, but asthma is of the small airways. And so imagine this branch is already small, and with asthma, it's just getting smaller. And we're gonna go through the visuals for that. Next slide, Heidi. So as an asthma educator and respiratory therapist, I know that there's a lot going on with asthma. So it's a lot of details, but I don't overwhelm people with the nitty gritty, so to say, of all the specific details. There are two main things that we focus when it comes to the asthma education. Next slide, Heidi. So the two main things that we want to know is the muscle tightening around the airways, and then also the swelling, the irritation and mucus blockage. So these are the two things that we speak on, because we want you to understand why you're taking the medications that you're taking. So some folks go home with more than one medication, and each medication has a specific function. So that's why we talk about these two specific things, so folks can understand the purpose behind the medication, which sometimes helps with the adherence, just people taking their medications. Next slide, Heidi. So yes, so when it comes to asthma symptoms, I hear it a lot. Well, I don't have asthma anymore. My asthma doesn't bother me, but I do have my main problem is I don't get a lot of sleep because of this pesky cough that keeps coming at night. So that makes my ears ring because it's a clue. It lets me know, like, oh, okay, so we're actually talking about asthma. That this may be a sign that the asthma is not under control. Wheezing. Sometime in different cultures, we don't know what wheezing is. In asthma education, I make the sound so people can remember. So wheezing is that it's a sound. It sounds like music, but it's coming from the chest. And that's because the chest is so tight that air is trying to squeeze in, really get in. So that's why it's making the sound. So I make the description and I make the sound as well. So just being out of breath, chest tightness, the elephant sitting on the chest, just feeling difficult, and fatigue and tiredness, especially in the little ones. We see this very quickly. Next slide, Heidi. Okay, so when it comes to asthma attacks, just knowing the signs and symptoms, like what do you see? And it's unfortunate that I had a patient that was a 5-year-old boy who the caretaker did not know the signs and the symptoms of asthma, and it took her a little late to give him his inhaler, and he was completely blue at that time. And we don't ever want to wait for those things to happen. So if you're speaking or if you're seeing someone speak like this and they're telling you they need a break, you understand? So if you're not speaking in full sentences and it gets to that point, don't play with those things. Not being able to breathe is nothing to play with. Take your medication, go to the emergency room, call 911, know the signs and symptoms. And the turning blue don't let it get to that point. And so I always advocate to folks. Sometimes we have cultures where they say, tough it out, but we want you to take your medications and go to the emergency room if needed. Next slide, Heidi. So the asthma medications, we have two. So we want you to know, and the commissioner, she mentioned her rescue inhaler and having it with her every day, even though she did not have symptoms every day. So that's why it's called a rescue. It should be on your person. It should be your best buddy. It should be by your side, right? So the rescue, and then we have our daily controller. So the controller, it's called a controller because it's supposed to be the thing that keeps you away from going to the emergency room and being hospitalized, and just helping tone down serious asthma attacks. So that's why it's called a controller. And we have different treatment plans out there. So we do have some folks that are now on a daily controller that can be also a rescue. But mainly we have the rescue and the controller medication. Next slide, Heidi. So for the rescue medication, sometimes called a reliever medication. So example of these are albuterol or levoalbuterol. So the function behind the purpose behind for these medication is to remember that tightening around the airway. So we want to make sure that we relax it back up so air can push through. So that is the purpose behind the rescue medication or the reliever meds. So it relieves the symptoms of the coughing and the wheezing. All right. And so common side effects, we do have folks sometimes that do have tremors, and I have asthma myself. So I do get, my heart rate does go up when I take the medications. So that does happen. Heidi, next slide, please. So controller medications, and you're going to see with the next couple of slides, there's so many of them now, so many medications out there, but there are different devices. Well, oftentimes we see inhalers and those that go into the nebulizer machines. And so once again, so many options out there right now. And then oftentimes they have combination medications. And the purpose behind this, remember, I was talking about those two important things to know. And so remember, we were talking about the muscle tightness, and then we're talking about the inflammation, and the swelling. So the purpose of this medication, the controller medications, is to reduce and prevent that swelling. So just making everything congested and the mucus and everything like that. So controlling that. So that's why it's called a controller medication, and it should be taken every day or as per your provider, the treatment plan that was offered to you, that was provided to you. And so the common side effects are oral thrush. So it's like a fungus buildup on the tongue. And so, and an increased upper respiratory infections and hoarse voice and all these things associated with the thrush. So we just want to make sure that in the next couple of slides, you'll see you can avoid those by using a spacer and rinsing the mouth. So for the inhale steroids, we call them inhale corticosteroids. These are these are the golden medication of choice for those with persistent asthma that is really a problem. And so this reduces the chances of needing oral steroids. So prednisone, oftentimes people will say, I went to the emergency room and I got the pills, and the pills help them a lot. So oftentimes people don't know how much more side effects come with the oral steroids. So we're trying to prevent you from needing the oral steroids. So this should be taken, as I said before, consistently according to your treatment plan that your provider gave you, and the side effects can be managed once again. Next slide, Heidi. All right, so yes, here is yes, I was trying to tell you that all the medications, now there's so much medications out there, different devices. And so I like to show things like this because oftentimes people will say the color of their device or the inhaler. So, and now there's a rainbow of color of devices out there. So we just want to make sure that you have an idea of what you have, you understand why you have it, and you know where it's located in your house, or it should be on your person. So that's why we show things like this. Next slide, Heidi. All right, so yeah, so here is the slide I was talking about, is to prevent the side effects from the controller medications. Remember to rinse the mouth and spit. We want to make sure we do that to once again prevent the oral thrust, which is that tongue buildup that you can see in the picture, that film. We don't want that to happen. And you can use something called a spacer, and all that is a valve, a device that you can put your inhaler in, and it helps with the coordination and avoiding this side effect. Next slide, Heidi. Okay, so when it comes to, I already mentioned the oral steroids. And so the purpose of the controller meds is to help you avoid the need for oral steroids, which comes with so many side effects. And so oftentimes we will hear different concerns of folks on their controller medications. They'll be like, oh, they don't want to take it because of the side effects. But what the controller medication does is it stops you from needing prednisone, and prednisone has way more side effects, and it affects the whole entire body, while your controller medication is specifically for the lungs. So it's going exactly where it's supposed to go. In regards to your inhale corticosteroids, it goes exactly into the lungs, and the oral steroids, it affects the whole body. So look at the side effects: weight gain. We're talking about, the high blood sugar being increased, and it just takes a long time to heal. A growth delay. Bone delay in growth and weakness in the bone. So we want to make sure that we're helping to prevent you from needing this medications simply, and this can be done by using the controller medications. Next slide, Heidi. All right, so what we look for is, remember, I talked about the nighttime coughing. We're looking for no coughing or wheezing. We're looking for no shortness of breath. We want you to be able to go to work. We want you to be able to make your money. We want you to we want little Johnny to play basketball, go to school, and we want you to get the good sleep. You understand? So this is what we listen for when folks talk. We ask the questions to see how we can help you in the quality of life and making sure that you can do these things. Once again, like the commissioner said, live your best life. Next slide, Heidi. So everyone with asthma should have an asthma action plan. So just making sure there's so many versions of asthma action plan. You can ask your provider for an asthma action plan. And I am a big advocate, especially for children, to have asthma action plan. Don't forget that it takes a village to raise a child. Think about it with those that have asthma. So we want everyone to know what to do when a child has asthma, when a child has an asthma attack. And the asthma action plan is very helpful for adults as well. Next slide. Is that it? Yeah. Thank you, Heidi. Appreciate it.
Thank you so much, Linda. That was a great presentation, and I hope everybody learned a lot. I know I did. The next thing we're going to do, we're going to have a little poll, test your knowledge. Hopefully you can see this poll. If you can't see it, please type it in the chat. The poll is, drinking coffee will stop an asthma attack. True or false? All right. Most of you have voted false. This is fantastic. Well, you passed. Thank you, everybody. I appreciate that. All right. So I guess we're going to share the result. Hold on. Just going to go back to the slides. All right, this is fantastic. Well, now I'm going to introduce you to Jessica Jackson and Zulima Uskonga. It's just my pleasure to have them here today. They're from AFA, which is the Asthma and Allergy Foundation of America, which is a patient advocacy organization that I've been involved with for over 10 years. So thank you very much for being with us today, Jessica and Zulima. I'll turn it over to you. Thank you.
Great. Thank you so much, Heidi. We're very excited to be here today. And thank you, everyone. We're happy to be here to talk about optimal ways to manage asthma. But before we dive into AFA's portion of the presentation, we'd just like to tell you a little bit about AFA and who we are. So we aim to be a trusted ally of the asthma and allergy communities, and AFA is dedicated to saving lives and reducing the burden of these diseases through support, advocacy, education, and research. And without you, our community, we wouldn't be here. So we really thank you for everything you do for those everywhere with asthma and allergies. And now I'd just like to hand it off to Zulima, who will talk a bit about managing asthma during pregnancy.
Thank you, Jessica, and thank you everyone for participating today. It's an honor to be here this afternoon. I'll be discussing asthma during pregnancy. Proper asthma management is so important for people who are pregnant and have asthma. So I'd like to share some resources for managing asthma during pregnancy. So during pregnancy, patients can experience changes in their asthma. Up to 40% of people who are pregnant with asthma will see their asthma symptoms get worse during pregnancy. And proper management and avoiding asthma episodes is so important. It's important to work with your doctors to follow your asthma closely and make sure that it is properly controlled. This includes things like avoiding triggers and taking medications as prescribed. Doctors may consider that some asthma medications are safer than others, and you may see some changes to your treatment plan during pregnancy and lactation. Next slide. Uncontrolled asthma reduces the oxygen content in your blood, and this leads to decreased oxygen for the fetus, which may affect their growth and survival. Common complications may include the risk of preterm or early labor and delivery, high blood pressure and preeclampsia, as well as low birth weight. And with that, Jessica, I'll hand it off to you.
Great, sounds good. Thank you so much, Salima. So now I'd just like to start off by oops, sorry, I'm in the wrong place here. Just to discuss how asthma is diagnosed. So Heidi, we can move on to the next slide. So asthma can be diagnosed by a primary care provider or specialist, and licensed providers who can diagnose asthma include physicians, advanced practice nurses, and physician's assistants. To diagnose asthma, your provider will discuss your personal and your medical history with you, and they will also perform a physical exam. Additionally, they might order a lung function test, and that's also known as a pulmonary function test, which typically can be done pretty easily in the clinic. Additionally, you might need other tests such as blood tests or chest and sinus x-rays. And certainly if you're having problems breathing on a regular basis, don't wait, visit your healthcare provider immediately. And next slide, please. So for diagnosing asthma, a physical exam is important. So it's important for diagnosing any medical condition. At your appointment, your doctor or healthcare provider will ask you about, again, your personal medical history. Specifically, they'll ask about your symptoms, your lifestyle, family history, and medical conditions. During the physical exam for asthma or allergies, your provider will look at your ears, nose, throat, eyes, skin, and chest, and they'll also listen to your lungs. And what they're looking for are signs of inflammation and allergies. They might also take an x-ray of your lungs and sinuses and do other tests to rule out other conditions. So if your doctor does find signs of asthma, they will discuss with you options for lung function tests. And there are several types of lung function tests, which we'll discuss shortly. And finally, if your doctor thinks you have allergic asthma, which is asthma triggered by things that you're allergic to, they may encourage you to do allergy testing as well. And next slide, please. So there are several diagnostic tests that can help you determine if your symptoms are caused by asthma. One test is called spirometry, and this is a type of lung function test that essentially measures how much air you can breathe in and out and how fast you can do it. So during the test, a technician will ask you to take a really big breath in, and then they'll have you blow out as hard and as fast as you can into a tube that's connected to a small machine called a spirometer. And a spirometer, it measures several different components of your lung function. And the test, it's typically pretty straightforward, but some people can feel a little bit lightheaded or tired required from the breathing effort. Sometimes your provider might have you do a spirometry with a bronchodilator test. And this test, again, it measures how much air you can breathe in and out and how fast you can do it, but both before and after you breathe in a medicine that relaxes the muscles around your airways. So with this test, again, your healthcare team will have you blow into the tube attached to the spirometer. And again, you'll blow out as hard and as fast as you can. And then afterwards, they'll have you inhale or breathe in the medicine that relaxes the muscles around your airways. And then as Linda was noting, when those muscles relax, it pulls the airways open so you can typically breathe more air in and out. After you've taken the medication, usually the technicians will have you wait about 10 minutes and then they'll have you repeat the spirometry test. So you'll blow into the tube attached to the spirometer, again, as hard and as fast as you can. And then your healthcare team will compare the test results before and after taking the medication. And if there's a significant change in your results, this can be a good indicator that you have asthma. So another diagnostic test is called a bronchoprovocation test, and this measures how your airways react when you breathe in specific substances. So sometimes with this test, you might be asked to perform it in a plexiglass booth or a box, and this is typically done in a hospital or a respiratory clinic setting. And during this test, you'll breathe in allergens or medicines that might tighten the muscles around your airways. And so clinicians, again, will measure how fast you can breathe air in and out, and they'll do this before and after you breathe in these substances. So peak expiratory flow tests or peak flow tests are another diagnostic tool, and peak flow test measures how fast you can blow air out at the top of your exhalation. So usually within about 3 seconds of exhaling, using your maximum effort. And peak flow is one of the components of your lung function that a spirometry test will measure, but you can also measure your peak flow using a small handheld device called a peak flow meter. An additional test is called a fractional exhaled nitric oxide test, or an FeNO test. And an FeNO test measures how much nitric oxide is in your breath. So high levels of nitric oxide may mean that the airways in your lungs are inflamed, and this can make it hard to breathe. And so for this test, you'll breathe out into a tube that's connected to a portable device, and it requires steady but not heavy breathing. In this test, it has relatively little or no risks, and it's done typically in adults and children age 5 and older. And then finally, your provider may order an allergy, skin, or blood test. And these tests can tell your doctor which allergens, like pet dander, pollen, molds, cause a reaction in your body when you're around these substances. And your doctor will especially do these tests, or is more likely to do these tests if you have a history of allergies or they suspect that you have allergies. And we'll place a link in the chat. The National Institute of Health gives a great synopsis on asthma diagnosis, and we encourage you to check it out if you would like more information. We also encourage you to visit AFA's website at afa.org. And next slide, please. So after you receive a diagnosis of asthma, it's important to take steps to keep it under control. And you can do this by identifying and avoiding triggers or things that make your asthma worse, by filling and taking medications as prescribed, working with your provider to create an asthma action plan, and also by maintaining regular communication with your provider. So it's also crucial to stay up to date with vaccinations like COVID-19, the flu, RSV, and pneumonia, and make and attend follow-up appointments with your provider. And also ask for accommodations at work if necessary. And on that note, I'll pass it back to Heidi, and she'll speak a bit about employee prescription access.
Thank you. I'm just going to talk a little bit about how to access prescriptions as a city employee. You may already know this, but it might be news to you. The first is through your health insurance plan. And then you might have coverage through your union or management benefit fund. You may also have it through an optional rider if you opt into an optional rider during insurance sign up. Now, and also you have a PICA card, I guess, that covers some self-injectable medications. If the medication copay, coinsurance, or deductible appears to be too high, speak to your doctor, pharmacist, or check GoodRx, PHRMA, or contact pharmaceutical manufacturers to see if they have a zero pay program. A lot of them do, but really when in doubt, check with your insurer and or union for information specific to your needs. Now I'm going to turn it back over to Jessica, who's going to talk about managing asthma at school, work, and home. Thank you, Jessica.
Thank you, Heidi. Yeah, so it's important to achieve and maintain asthma control and manage it across multiple settings, including school, work, and home. So now I'd just like to share a few strategies for doing so. And next slide, please. So a good place to start managing your asthma is by creating an asthma-friendly home. And this involves adopting multi-component strategies that help create a space that's free of your asthma triggers. And again, asthma triggers are things that people with asthma are sensitive to, and when they're around them, it can trigger inflammation in the lungs and can make asthma symptoms worse. Examples of this can be dust mites. And one way to control dust mites is by keeping surfaces clean and uncluttered, vacuuming with a HEPA filter vacuum, encasing your pillows, mattresses, and box springs with zippered allergen-resistant covers. Additionally, if you're allergic to pet dander and have pets, it's really important to keep animals out of your bedroom. Also bathe your pets regularly and keep them groomed. If you have to bathe your pet and you're allergic to an animal or your pet or your animal, be sure to wear a mask. And also be sure to clean your animal's favorite furniture or toys. Another important step is to prevent pollen from getting inside your home. And one way to do this is to keep your windows closed, especially on high pollen count or windy days. And try to use, if possible, air conditioning in warm weather. This not only traps some of the pollen from the outdoors, but it also helps to control dust mites by reducing humidity. So dust mites thrive in humid environments. And additionally, if you are using your air conditioner, be sure to change your filters often. You also want to try to avoid the growth of mold spores. And the best way to do this is to reduce moisture around the bathroom and the kitchen and other areas where there's a lot of water. And so it's really important to fix leaks and also improve ventilation in rooms like bathrooms by using fans or keeping windows open if it's not a high pollen count day. Additionally, controlling pests like rodents and roaches helps reduce asthma symptoms. Try not to leave food or garbage uncovered. And for roaches, use poison baits, boric acid, and traps instead of chemicals, because chemicals can irritate your sinuses and also your asthma. Additionally, you might want to consider using air cleaners with certified asthma and allergy-friendly filters, which are proven to capture allergen particles and irritants from the air. And you can look for asthma and allergy-friendly devices at aafa.org/certified. And finally, it's also important to avoid exposure to cigarette smoke, emissions from vaping, and strong scents and harsh chemicals. These things, they're very common triggers and can make people's asthma worse, or they can even cause other health problems. And for more information, please feel free to visit the AFA website at afa.org. And next slide, please. So creating an asthma-friendly school environment is another key step to managing asthma, especially in children. There are some simple steps you can take to help your school become asthma-friendly. So first, start with the classroom. Encourage teachers to use only approved cleaners from custodial staff. Cleaners like Fabuloso, Pine Sol, those should be avoided because they tend to have very strong smells, and these smells could act as a trigger for some students and staff who might have asthma. Air fresheners, scented candles, even disinfectants may also contribute to an asthma trigger or flare, and if possible, should be avoided. It's also critical to improve indoor air quality. So students and staff spend most of their days inside a school building without the ability to control the air they breathe. So they depend on schools to provide the healthiest indoor air quality possible. And allergens, asthma triggers, and chemicals, they're common in many school buildings, and they do create poor indoor air quality. Reducing these triggers, like allergens and irritants, is a key part of asthma control, as unhealthy indoor air quality can lead to not only more asthma symptoms, which can then lead to more missed school days and then even hospital stays, but additionally, children with uncontrolled asthma often struggle to learn, and they could fall behind academically. So schools can make changes to improve indoor air quality, many of them for little cost. So for example, schools can clean with unscented and less harsh chemicals. To reduce pet dander, they can avoid keeping furry or feathered pets in the classroom. And certainly fixing leaks quickly to reduce the chance of mold growth is important as well. And finally, placing certified asthma and allergy-friendly air cleaners in classrooms with children or teachers who have asthma can also help reduce asthma exacerbations or flare-ups among students and teachers. So improving indoor air quality, it not only creates a healthier school, but it promotes better learning as well. And next slide, please. So if you have children, managing asthma in school settings is extremely important. There are a few steps you can take to do so. So for example, every student with asthma or allergies should have a school healthcare plan, which lists their symptoms, their medications, and the steps to take if they have asthma symptoms. And the three most common types of these plans are emergency care plans, individual health plans, and 504 accommodation plans. Make sure to contact your child's school to talk about which care plan your child needs. Then be sure to put the plan in place and get copies of school medical forms and share them with your child's provider at summer checkups. And next slide, please. So managing asthma in the workplace is crucial as well. In the United States, as many as 15% of asthma cases may be work-related. And more than 300 substances, such as chemicals and irritants in the workplace, can cause or worsen asthma. So work-related asthma is when your job exposes you to triggers that cause asthma. And in developed countries, it's one of the most common lung diseases related to work. The symptoms of work-related asthma are the same as general asthma, so that combination of coughing, wheezing, shortness of breath, chest tightness, or pain. And according to the CDC, there are two types of work-related asthma. One is called occupational asthma, which is asthma caused by exposure to a substance at your job. The other is called work-exacerbated or work-aggravated asthma, which is existing asthma made worse by exposure to triggers at work. And next slide, please. To control your job-related asthma, you may need to work with your doctor and your employer. Together, you'll need a plan to manage exposure to both triggers and irritants. And when your asthma is under control, it benefits not only you, but your employer as well. So it can help you be healthier, perform better at your job, and help you miss fewer work days. Sometimes work-related asthma, it can go away once you're no longer around the substances that trigger your asthma. But if you have constant exposure to some triggers, such as strong chemicals, there's a chance your lungs could become permanently damaged. And some people do develop disabilities due to long-term untreated work-related asthma. So this is just one of the many reasons why it's very important to address your work-related asthma with your employer. So you want to work with your employer to find ways to remove your asthma triggers from your workspace. Start by talking with them about getting personal protective equipment or PPEs, such as N95 masks, or depending upon your job, you might want to ask if there's another job you can do that doesn't expose you to any asthma triggers at all. AFA has actually created an asthma-friendly work and school spaces checklist, which you can download, print, and share with your manager or human resources department. And we encourage you to do that. And we encourage you to review the checklist and see if there are ways to improve your workplace for people with asthma. And we will share the link to that checklist in the chat. And next slide, please. So there are steps you can take to support coworkers with asthma. It's important to reduce chemical fumes, fragrances, and other odors. For instance, don't wear perfume, cologne, or other scented personal products. Avoid using air fragrance sprays, incense, candles, and air fresheners. And try to avoid using materials with strong fragrances or fumes. So for example, markers, paints, adhesives. Additionally, be sure to wash your hands often to avoid the spread of viral illnesses, as things like the flu, cold, RSV, those are big triggers for people who have asthma, or they can be. And then know what asthma warning signs and symptoms to watch out for, and then learn how to administer emergency medicine if appropriate. And we'll share links that provide more information about work-related asthma in the chat.
Great. Thank you so much, Jessica and Linda. I really appreciate you guys. We're about to the Q&A section of the webinar, but first I would like to share some resources with you. And just a gentle reminder to put your questions in the Q&A and save the chat for comments. This is some resources for AFA and a reminder that we're going to be able to send you this deck after the webinar is complete and give you all of these things in one place. This is more resources from Linda, the asthma lady. Fantastic presentation today. So in summary, we covered what is asthma, what are the triggers, how to create safe spaces, how and who diagnoses asthma, what to expect during a doctor's visit. And we also included some education on asthma management at school, work, and home. But now we want to hear from you. It says type your questions in the chat, but type your questions in the Q&A, please, and we will do our best to answer them. We also had some questions before, because we asked people to type their questions into the Zoom if they wanted to ask them before. So we do have some questions already teed up. Let's see. All right. I'm going to read, as these questions come in, I'm going to read a question from the Zoom. Okay. What kinds of physical exercises are suitable if you get out of breath easily? And are there any breathing techniques that can improve the effect of asthma? Linda, this has your name on it, but I will defer to anyone else if you don't want to answer that question.
Heidi, I'm sorry, I missed it. Can you repeat?
No worries. What kinds of physical exercises are suitable if you get out of breath easily? Are there any breathing techniques that can improve the effect of asthma? Now, I just want to remind everybody before Linda answers that none of us are doctors. So.
It's fine. And from what I've seen and what I've done myself is yoga. That's a good one. So something like yoga. But once again, if you know you need your medication, you take the meds. But something like yoga it does help, and also with just calming you down. Anyone that has panic attacks, anxiety, so does that does it can help.
And just to add, check with your doctor if you have further questions on that. They really do know a lot. Okay, we have other questions coming through the Q&A. Oh, all right. Let me see. We can't see your questions in the chat. I think there's a lot of questions coming through the Q&A. Would you be so kind as to put them into the Q&A instead of the chat, if that's at all possible? Here's another question for you. Are there any preventative measures to keep asthma from developing besides maintaining proper nutrition and sleep, exercise, and not smoking, especially if you live in areas of higher asthma incidence? Linda, do you want to take that one?
I'm sorry, I missed it again.
That's okay. Are there any steps that preventative measures or steps to keep asthma from developing in the first place, besides proper nutrition, sleep, exercise, not smoking, if you live in a area of higher incidence of asthma?
Okay, so from asthma from developing, asthma, it's biological, so it can, it's one of those things. If it's within your family, yeah, you might you might get asthma. As far as, once again, we did speak about triggers, so everyone is different. If you're exposed to allergens for long periods of time, so it can be the condition of a building, anything like that, this can exacerbate asthma. Remember, asthma is dormant in the body, so it could just be there, chilling, and something can make it come out. So yeah, that's my answer to that one.
Thank you.
Mhm.
We have some cleaning questions. What type of cleaning materials are recommended? It says for H&H cleaning, it looks like, very specific. I think we can just comment on generic cleaning materials, not specific to any agency. And then the other question is, what products are safe to kill and clean mold surrounding AC units or any moist areas? I just kind of combined those questions.
Am, am I going for that too?
I don't know. Do you want to go for it, or do you want to ask? We can see if Jessica wants to answer that one.
Jessica, you want to go? Because I was gonna say, like, for household, because I can't talk about H&H specific, but household, we do say, the vinegar and baking soda, you can use that for mold, and because we don't want to go for the bleach, because that can trigger someone with asthma, and I'm one of those people that cannot smell bleach, so I don't go for that. So that, but specific to the H&H, I can't touch that one.
Yeah, so same here. I can't really touch the H&H one either, but I agree with what you said, Linda, about the home cleaning. I also did post a link in the chat. So the EPA has a great list of safer cleaning products as well. So I put that link in the chat. They list out, I think Green Clean is one, and there's a bunch of others that they suggest over some of the harsher chemicals. But certainly, yes, like vinegar, I want to say maybe baking soda and water can help too, but I know for sure, yes, absolutely the vinegar. And yeah, the bleach is a little bit controversial because it can, like Linda said, trigger asthma for some folks. So
yeah. Yes.
Okay. Can you all, Jessica and Linda, can you see the questions coming in for the Q&A?
All right.
I'm hoping you can see them. We have several of them, and I know we only have 3 more minutes.
I responded to someone. I'm trying to see where I put the responses, and trying to look for the question now, but it was in regards to, once again, the difference between asthma. I know a lot of folks were hearing earlier within the past year about RSV and asthma. So they were asking the difference between RSV and asthma. So the difference between the two, the response that I gave that person, I can't find it now, but is that asthma is a chronic lung disease, so it is with you for life, like we mentioned before, but it can be controlled. And RSV is a virus, so it is like the common cold virus, and so RSV can be with you for like 2 weeks. So that's the difference. So one is for life, you know, but can be controlled, and the other one is a virus. So we want to think about things like hand washing and you know, disinfecting different areas to avoid RSV.
Right. Thank you. Well, thank you very much. I'm sorry, guys, we're running out of time here, but I just want to thank everybody for coming. Here are some references. Again, we will send these all to you within the next couple of days. I want to talk about some great upcoming events. 2023 Summer Wellness Block Party coming up September 20th, Hispanic Heritage in October, and Breast Cancer Prevention also in October. Now we're going to have a quick survey. And this is very, very quick. And I just want to thank everybody for speaking today. I'm sorry I kind of skipped that part, but thank you to Linda, Renee, Zulima, Jessica, and everybody at AFA. We should have that poll up. I'm not sure. Let's see. We're going to launch the last poll, which is, what did you think of this program? Please enter your feedback. We need your feedback so that we can continue to provide webinars for you that work out for you. So have some coming in. Great. Well, thank you very much. Thanks very much for filling that out. I'm showing it so everybody thought we were good to excellent. So thank you for that. All right. So next, keep in contact with us. WorkWell NYC, we are on the web, we are via email, we are on Instagram, YouTube, and LinkedIn. So we hope you enjoyed it. Thank you so much for giving us your time today. Be well, and if you have further questions, please talk to your doctor about your asthma plan. Take care.